Hey everybody, Dr. Lee Sierra, and we're getting ready to wrap up our month of chiropractic research studies, and I'm going to finish up this series with 2 articles about pediatrics and chiropractic. So the first one today is going to be called Why Infants Need Chiropractic. And again, you can find all these articles in detail on my website at drleesierra.com/research. And this article is talking about how when you have a baby or right after they're born, there's oftentimes issues that we don't even notice. I was adjusting a baby the other day, and she had been having a head presentation off to one side for many times that I had seen her in the office with her mom. And a lot of times we don't even know what's causing that. We just think it's, oh, the baby loves being in that direction and so forth. But the reality is that oftentimes because of birth trauma, if you've had kids or ever been at a delivery, there's a lot of pulling and tugging often done on that baby, as well as the baby has to come through the vaginal canal, and it's a small space. So when the baby's coming out, oftentimes they have to, in order to come out, roll their body over. And then if you're having sometimes having a birth where the baby gets stuck, there's sometimes pulling on the baby's head or pulling on their shoulders and things like that. Birth trauma can be one of the ways that our babies can get subluxated or their spine can get misaligned right from the start. This article, as you'll see on my website, and again, I'm just looking over at my computer screen referencing it, is the first thing they talk about is that there was a study done that 90% of newborns experience some effect of birth trauma. So usually it's associated with the neck. This was not a chiropractor who determined this. This was an osteopathic doctor, Dr. Fryman, and she studied more than 1,500 babies, and these were assessed between 1 and 5 days of birth. Most of them were assessed at less than 24 hours old. And basically they determined that only 10% of newborn babies had perfect freely moving skulls and upper cervical spines. As many as 80% had some strain on some sort of the cranial mechanism. So whether that's the head or the connection to the upper cervical spine and things like that. And also one of the things that she noted is if that's left uncorrected, that can cause abnormal growth of the spine and so forth. So as a chiropractor, one of the things that we highly recommend is getting your babies checked as soon as possible. My son Kason was adjusted, of course, the day that he was born by myself. I'm happy to check out anyone's babies. If you've been a patient of mine, and you're pregnant, I'm always willing to come to your house or whatnot. And also the other thing that I'm happy to do is come into the office. If you're worried about being around all those other people, or you're like, oh, my baby's always crying, please don't stress. Our patients love seeing little kids. But also the other thing is you can come during our off hours. I'm happy to adjust them then, or at least check them out to see if they have anything going on. Because one of the things is, so if they have birth trauma from the time that they're born, and then just think if we left that untreated. So now they're going on 4, 5, 6, 7 months, and they're learning to crawl, and then they're learning to walk. And then if you're like my son, he's learning to climb up on the bed, and he's jumping up and down, and we go to the sky zone, and we're playing on the trampolines and all things like that. Just think about how much that trauma is now going to be affected because they're crawling and walking and falling and learning how to do all these different things that are part of their, their growth and development. But then look back and they still have a spine that's maybe misaligned, or their skull has been not forming in the proper mechanism because of that birth trauma. So birth trauma is not only caused just from vaginal births. C-section births can cause birth trauma, just the way that the baby comes out, as well as the fact that they didn't go through the natural processes of going through the birth canal. So check out this article. If you have more questions about that, feel free to reach out to me. A lot of questions I get from new parents is, how do you adjust kids? Is it the same way you adjust an adult and things like that? It's not. It's very, very low force, especially for newborns. It's super gentle. After I have my baby, I will be happy to post a video of her first adjustment, or, one of her first adjustments, so you guys can all see. And, if you have questions, I have tons of patients who are always happy to have you come by so you can see how I adjust and whatnot. So don't hesitate to reach out to me and let me know if you have questions or concerns, or you're thinking, wow, I need to get my kid checked. So feel free to, we can set up an appointment for that. So again, I'm Dr. Lee Sierra. If you want to see this article, it's on my website, drleesierra.com/research, and it's called Why Infants Need Chiropractic. Bye.